All right. So I should start now, right? I'm live. All right. All right. Thank you. So first and foremost, very good evening, good afternoon, good morning, wherever you are listening from. I want to thank Genoveva for, creating such a wonderful thing that I'm hearing everybody since morning. People are sharing their such amazing work, and you have created a beautiful platform. So, it's something right from every homeopath's heart to your heart. That is the kind of connection which we are feeling here. So thank you, Genoveva. I'm going to be talking about how gratitude helps in managing adult ADHD. So, a little bit about myself. I'm Dr. Vrushali Saraswat. I'm from Mumbai and I'm practicing for last 25 years. My focus of practice is mental diseases and mental illnesses, wherein I kind of have an expertise in managing depression and ADHD. So a lot of times people already come with their own diagnosis, but today in these 20 minutes I'm going to make an attempt at even walking you through you know in short how you can diagnose yourself. So you need not depend on the modern medicine or some other physician who is going to give you a diagnosis. Okay. Genoveva, can people write in the chat to me? Yes. And I can see that chat, right? Okay. All right. Fantastic. So I would want the audience to be very, very active and do let me know if I'm going fast or slow or whatever change you want me to do. Okay. So I'm going to start sharing right away with a case because nothing can teach you better than the case, right? So there was this young lady she came to me with migraine, and she had 3 to 4 years she was experiencing a lot of headache. Okay, should I go slow? Okay, slowly I should speak and not at the speed. All right, fantastic. I think we are playing dumb charades also pretty well today. All right. So there was this young lady who came to me with migraine. And since last 3 to 4 years, she was having every single day headaches. So headaches were aggravated by talking, noise, open air, and she would just want to sit alone. Okay. And there was nothing which was going to give her relief. She did not like sitting in a movie. She did not like to attend, or she did not like to basically sit down at one place and do things. She would talk incessantly, and she, she had terrible anger, intense anger, wherein she would break things in her rage. And she was like, another funny part was she disliked being told what to do. Okay. And because of that, she had a lot of fights in the family. Now, there were some other, like she had palmoplantar psoriasis also, along with a little bit painful maculopapular rash she was experiencing on her palms since 4 to 5 years. Okay. So this was her totality. Now, the life story goes like this, that she was divorced 3 months after marriage because on the day of her wedding, she found her husband cheating on her. And, she was, any which ways, a very rebellious person. She was having that marriage against her family's wish. So the maternal family had cut all the ties with her any which ways. That time, the person with whom she was getting married, he was her boss. Okay. So because now she's on the day of marriage, she found him cheating. So in one day, she lost her job and her husband. So she got married, and the same day, trouble started. So she had to quit her job. She was working in the national capital of India, Delhi, that time. Then she had to move to another city because family is not looking after her. Then her husband, for whom she cut ties with her family, he is also not there. So at that point of time, one of her colleague was beside her. Like he stayed with her through all those troubled divorce and lot of complications what she had. So that colleague, she is married to him right now, and he is a very very quiet kind of a person. He very nicely he supported all her tantrums, and he looked after her very very well. In that moment she had a feeling of being dizzy, like uh, deceived, cheated, and she felt unrequited love. Okay. Then the second husband was very caring, loving, respectful. In all of that mess also, first she had actually conceived before marriage, and in India it is not considered really a very good thing. Okay. So any which ways she was in trouble, but she delivered that daughter from the first husband. Second son is from the second, like the second child is a son from second husband. Now parents still don't talk to her, but she had a elderly lady looking after her family. And this lady was very very close to her. So in all her trouble, tantrums, her victimization, all those things, this elderly lady and the husband, they were looking after this patient. But one day she, in her rage, she broke something, and the elderly lady who was her maid, she started telling her that this is wrong, what you're doing is not a good thing. But she never liked to be told. So she started having a fight with her, and then in all of that ruckus, the maid said, fine, now I'm leaving you, I'm going away, I cannot manage with your tantrums. So there also she felt the same feeling what she had felt with her husband, that she felt deceived, cheated, and unrequited. And that's where all her migraine started coming up. Okay. So the whole migraine problem started because this now she had only two pillars. One was husband, another one was this maid. And this maid also decided to leave her. That she couldn't bear. Suddenly, now all her life became shattered. Okay. So she started smoking, and like she used to smoke always, but the only ameliorating factor in her headaches was smoking. Okay. And very peculiarly, even during both her pregnancies, she would smoke. And that was something very, very peculiar because, mostly mothers, even if they're smoking, they will stop it during pregnancy. But this lady did not stop even during pregnancy. She continued smoking because that was the only thing which would reduce her headache to a certain extent. Okay. So it was very, very PQRS. And I started noting it. I started putting it directly in the repertory. So before we go to the diagnosis, I will walk you through what symptoms I was taking. So typically when a patient comes to me, what I will do is I will immediately enter all the symptoms in repertory, so that it becomes easier. We can ask the questions in a way that whatever remedies are coming up, we can go on asking confirmatory questions to the patient right then and there. Okay. So I first, as she was telling me all the symptoms of her headache, I started entering headache into repertory. So smoking amelioration was extremely striking for me. And interestingly, there is only one remedy which is covering smoking amelioration. Then there was open air aggravation, listening and reading to aggravation, motion aggravation, smoking amelioration, and talking aggravation. All these symptoms we had taken. There was, interestingly, one remedy which was covering entire symptom complex of headache. So I kept that. Then she felt everything is unreal around her, and she did not want to come out of the bed. Okay, there was confusion of mind, there was mental exertion, there was leaning head on aggravation. So whenever she would have headache, with that she would feel confused. Okay, and there was aggravation when she would lean the head in the forward direction. So we took that confusion of mind better by smoking. Then she was suicidal, she had aversion to her family, and there was a weird anxiety which she would feel in as if cramps in the stomach. Okay, again arania was something which was coming up, and this is a very very old case. I was not even well versed with the spider remedies at that point of time. Now I teach spider remedies into detail, but I was not aware of spiders at that point of time. So I still went on taking different symptoms. So remedy is not the point of discussion today. So I'm just rushing through that whatever board we are picking up, everywhere I was seeing that arania is coming up as a remedy. Okay. Then she also had like lascivious, voluptuous dreams, frightful nightmares, and she would wake up screaming so many times that she would wake up screaming. Her husband had to literally hold her for a while, and then she would calm down. She would feel as if it is absolutely real. And there are only two remedies, arania and arnica, wherein the person wakes up screaming from the nightmares. Okay, so that just confirmed the remedy. Then cracks and fissures, again arania was there. Eruptions, again arania was there. So you see, typically all these things were there, and she demonstrated a lot of irresponsibility towards herself. So this, I think the slide is coming. All right. So first, before we go to the remedy, I wanted to understand as to what diagnosis can we give it to her, because her behavior was very very peculiar. If I can see some of the people, I mean, if you can, in the chat, you can write what diagnosis or what remedy are we thinking about for this particular lady. So two questions: what diagnosis wise, what are we thinking? Secondly, what are we thinking about the remedy? If people can write in the chat. Is our audience responsive, Genoveva? Hysteria. Yes, that's a good one, Elena. Hysteria is a good thing. But hysteria is too general, right? Mood disorder, anybody? So my question is, what diagnosis are we thinking about for this lady? And secondly, what remedy are we? Yes, I have spoken about arania quite a lot. So let's talk about what diagnosis. So Helena is saying anxiety and ADHD. Yes, that's a good one. All right. Okay. So let me take you forward as to why am I saying everything seems like it's a dream or unreal. Yes, that is a good one. Medurinum. Anger and ADHD. Yes, Sanjeev, that's a good one. Yes. Might be residue of trauma. Yes, trauma is the reason of her suffering, but how she is perceiving as everything to be a trauma, we will talk about that. So wonderful. I'm glad that you guys are listening to me. Okay. Okay, there's something. Ras glabra. Oh, lovely. Lovely. Very good. I think it does come in one of the repertorization chart. Okay. So let me walk you ahead as to why I'm saying that this is a case of adult ADHD. Okay. And I'm slowly going to walk you through what ADHD is. Just give me a, yeah. Okay. So typically, ADHD has three parts: inattentiveness, impulsivity, and hyperactivity. And it is going to be always a combination of these three set of symptoms. Okay. So in this particular lady, we did have hyperactivity and impulsivity. She also, so many times, she has expressed inattentiveness as well. So typically, it is diagnosed in children. However, this is one disease which does not go away even when the child becomes an adult. So there are so many childhood illnesses which will remain in the childhood, and as the person grows up, they will vanish, but ADHD does not. So, and so many of, the middle-aged people today were not diagnosed in their childhood. So it is a biological disease. It is the biological one, so genetic material affecting the psychosocial factors, and then the clinical expressions are coming up, along with the child's environment that plays a major role. So this particular patient comes from a broken family, and she had like an abusive father who was continuously beating up the children in all his drunken rage. So she did experience like a trauma right in the childhood, and that also affected her attention. So attention becomes a problem of learning. Why? Because whenever they are failing into certain thing, those experiences, they are again making them a poor learner, and eventually they land up becoming attention deficit, that they are not able to pay attention closely. Okay. So there is visual or auditory stimuli are not understood by the person. Okay. There is a lack of full comprehension, and therefore there is the symptoms, or the stimulus which is coming from outside is not processed properly in the brain. So there is no organization of the input which they are receiving, and there is an inability of to coordinate motor or behavioral activity. For example, if they want to learn tying a shoelace, the somebody is teaching them how to tie a knot, they are not able to process all those commands sequentially, and therefore they suffer, and then they are not able to do it. The failure again puts a lot of stress. Okay. And my topic today, why gratitude is important, because I will walk you through how hormones are level or stabilized with gratitude, which is such an essential thing for an ADHD person. Okay, so persistent adult ADHD is 2.5%. So 2.5% of the entire population is having adult ADHD, which is like a huge number if you look at it. Okay. So let's not walk into details of it, but you can have a look at it as to how neurosensory and motor coordination, they find it difficult. Okay. So a lot of time their confusion is leading to their inattention. So the lack of attention is in reality confused state. So they require a lot of love and care, and not the other way, because most of the time the children or the adults who are experiencing ADHD, they go through a lot of shame and guilt, and that also causes further inattention on their part. So they cannot do sequential work, they cannot draw from memory, they cannot recollect things, they cannot imitate actions, and because of all this, short-term memory also becomes a problem. Now, how do you identify? Because when children come to you, they will be, hyperactive, and you can immediately make it out when you look at an ADHD child. But how do you identify when an adult comes to your clinic? How do you diagnose him? So there are certain scales, and one of my most favorite scale is ASRS, which is Adult ADHD Self-Report Scale, wherein You give them a set of questionnaire and they are supposed to put their own numbers in that. So it becomes quite easy for them, and prognostically also for us to compare before and after. It becomes very, very easy, and it is right there in front of them. We don't even have to interpret it, that scale. Okay. So I had put that scale before. Okay. So yes. So this is the scale. This is how it looks. And people don't even have to give numbers, because here you can see that, these people are weak in their mathematical skills. So they don't have to put numbers. They just have to, wherever they are experiencing that certain thing, they just have to put a cross in that section. Okay. So it becomes very easy. And you can see that this lady, when she had entered before the treatment, it was quite on the darker side. But after the treatment, 3 months down the line, all the symptoms started moving towards the lighter side. So it started reducing. So it's a quite visual clue. Okay. Now let's move forward. Okay, so these are various set of symptoms wherein ADHD can be displayed. The symptoms of inattention, how do you see it? So they will be careless, they will make mistakes due to lack of attention to details. There will be difficulty in sustaining attention. They will not listen when spoken to directly. So you see how she expressed a lot of anger when she was told to do things. Okay, because half of the time she's not listening. So it's not in reality anger, but her inability. Okay, she failed to follow through tasks, so she could not keep her job also. There was poor organization. They avoid or dislike tasks requiring sustained mental effort. Okay, so they do not want to be told, like they don't like when people are repeatedly telling them something to do, because first thing, there is a confusion. They're not able to process it as fast as the world is doing it. So therefore they will get easily distracted and they will be forgetful. So they are not going to be a super performers. Okay. Now, what are the hyperactivity or impulsivity? So they will continuously be moving. Okay. They cannot sit quietly. So typically, as in this case also, she cannot watch one movie at one set, like 2 hours also she can't sit in a theater alone. So her husband prefers that they don't go out to watch movies. He said, I can't be wasting so much of money. So what he will do is, he will wait for the movie to come on the OTT, and then he can watch it on his TV or whatever. So she will leave mid conversation. Okay. So this is hyperactivity. They are always on the go, and they will be too much. They will be talking, and they will not even wait for their turn. So that will also be difficult. So in children, hyperactivity, you can see it very easily. But in adults, these will be the symptoms which you can check for yourself. Okay. Now, arrhenia, I've already spoken about, and I've given so many symptoms of arrhenia. So, because we have to go to the other side, which played a major role in this case, therefore, I'm running through and I'm telling you directly that we did give her arrhenia diadema 1M. We gave it BD for 2 days, and after a week only, she did not have headache, and eventually her smoking also reduced. After a year, migraine went away. And after 2 years of treatment, she did pick up a job. Okay. Even though it was part time, like she worked only for 4 hours, but she did pick up a job and she kept that job for a longer time. Okay. Now, what were the symptoms? So, in a brief, I can tell you that there was confusion, smoking, family aversion to feeling cheated, want of love, inactivity, anxiety, melancholy, and depressed. These were some of the prominent arrhenia symptoms in this particular patient. Okay. Now, coming to this part. So, I always believe that gratitude plays a major role while we are treating any mental disorders, and especially ADHD. Okay. But initially, gratitude was extremely difficult in this patient's case because she was highly ungrateful. She did not see what she has. What she always saw was victim consciousness. She was self-centered, and only survival was on her top of her mind, and she did not want to take any responsibility. She simply wanted to enjoy her life, but she did not want to take any responsibility. We can see that a pregnant lady smoking. So smoking in a lady any which ways in India is not something which we commonly see. Plus, she had this habit that during pregnancy, she's not even thinking about her fetus, but she is thinking only about her pleasure. Okay. So you can see relationship wise, she was absolutely ungrateful to her parents. Whoever is talking nicely to her, thinking about her, she is ungrateful to them. Okay. So initially, it was very difficult for me to make her understand to look at what she has, because this victim mindset or ungratefulness was her core. But post remedy, gratitude slowly started seeping in. Okay. Migraine resolved, restlessness reduced, reflection increased. She started thinking about the consequence. Not completely, I would not say that she completely started introspecting or whatever. No, but reflection increased a little bit. Little bit at a time is also nice. She even attempted few times with me guided meditation, and her relational awareness increased. Okay. So that happened post remedy. Now, here was the time when I introduced gratitude in her. So, why gratitude was needed was, you see, dopamine. So, the ADHD is not a hormonal disorder. Okay. It is not. However, it is poor coordination, and the timing is so bad that they do not have uh, a complete regulated hormones. And because of the disease itself, you see, there is dopamine dysregulation, there is noradrenaline imbalance, they are chronically stressed, and therefore the elevated cortisol. Serotonin is unstable, their emotions are always haywire because of the confusion, because they always feel that they are lacking into something. There is a disturbed melatonin rhythm. So these are the people who will generally be night people. They will not be the morning people. Okay. And there is a reduced oxytocin signaling, therefore making connection is difficult for them. So even though it is a motor nerve disorder, still it is getting, the hormonal cycle is disrupted completely. And here comes the role of gratitude, because gratitude is not positive thinking or moral instruction or forced journaling. It is your nervous system regulation. It is internal safety, and it is a signal to the hormones to balance itself. And why I can say that, because I'm sharing it very proudly that so far we have trained more than 15,000 people with my LIFT program, which is Life in Full Transformation, wherein I teach people to practice gratitude in different areas of life and how it transforms. So some cases, magical cases which I can share is somebody who is in a pre-diabetic zone, has skin tags, okay, around the neck or in the armpits or things like that. Two brothers who attended my lift program, their skin tags dropped on the seventh day just by practicing gratitude. So that is the power of gratitude, which can reset your hormones completely. Okay. Gratitude reflects biological stability, and it is not willpower. So therefore, it becomes extremely essential that the ADHD patients, we first we give them remedy, and then we help them to walk the path of gratitude, because dopamine would be released with gratitude, and it will shift the focus from seeking to receiving, because it's a reward hormone. There will be an internal reward which will be replacing the external chase, and impulsivity will reduce. So better task persistence, reduced restlessness, these will be the outcomes clinically which you will receive once you train them for gratitude, once the ADHD patient starts practicing gratitude. Okay, how the noradrenaline will reduce, because in ADHD there is hyper alertness or attention collapse, poor signal to noise ratio. So whenever they are getting a signal and the noise, they have a imbalance in that, and therefore noradrenaline will be excessively reduced. But with gratitude, the stress will be completely, it will tone down, and therefore attention will become sustained, and their listening capacity will increase. And automatically, because the attention and arousal is toned down, they will have improved focus, and there will be no overstimulation. Okay, so gratitude is essential. Then cortisol will definitely be reduced, because the hypothalamo-pituitary axis will, hypothalamo-pituitary adrenaline axis will be regulated. So cortisol secretion will reduce, stress will improve, and automatically they will feel more at ease, and there will not be emotional flooding. So you see the level at which these people are resonating, that will improve with gratitude. Now, serotonin, we all know. So, you express gratitude once and dopamine will be released, which is a reward hormone. And it is kind of an addictive one. But you go on consistently expressing gratitude, serotonin will be released, which is a mood stabilizer. And with gratitude, there will be an emotional continuity which these people will experience. So the impulse control will be less, and they will tone down complete, their behavior will be, so all these mood swings, that victim mindset, all of that will go down if the serotonin levels are high. And therefore, better emotional stability will be achieved. And then their impulsivity, their inattention, their focus, everything will change, and they will have little bit patience with themselves. Okay, and oxytocin, obviously we know that with gratitude, the oxytocin release will increase, which will improve bonding. And when anybody who's feeling like a victim, when that person receives a genuine bond, their whole relationship with themselves will also change, and the dependency will reduce on others, and they will improve as a person. Okay, so again, the same thing with melatonin, improving circadian rhythm. Same, gratitude will help the melatonin to settle down, and the nervous system will undergo a state of repair when melatonin is in the proper state. Okay, so scientifically, so I'm not saying that this is a willpower, but scientifically, when all these hormones, the small ones, when they are taken care of, and how can you do that? Simply by expressing gratitude for things which you have right now in this moment. It becomes so easy to train them. So I'll give you another example. In this particular lady, definitely she took almost 3 months to write her first gratitude. But there was another patient of mine who was also having ADHD and adult ADHD. So he was a 30-year-old CEO of a company. Okay. And he was so hyperactive and quite impulsive, very angry young man kind of a fellow. When I trained him in gratitude, he started giving gratitude right from the first time he wakes up, because incidentally it so happened that in his company there was a 45-year-old fellow who passed away due to heart attack. And that was the time he realized that he is so blessed that he is receiving every single day to live and experience and to give, uh, to experience life, basically. That itself shifted so much inside him. He started giving gratitude to water, to food, to life in general, and his whole perspective changed with that one small thing, that right from the time he wakes up till the time he goes to office, he had to be like he has to remain continuously in a state of gratitude for whatever he is receiving. His relationship with his mother improved. His relationship, which was extremely abusive with his girlfriend, that improved. And he started performing at his best. He was any which ways too good, because all these ADHD people, they are intellectually at a very higher level, but just because they are not able to stay focused, so his focus improved simply by expressing gratitude. So his remedy was also from spider, but that is for some other time. Okay, so but then important is sequence. Gratitude not before regulation. Okay, because if you don't regulate their system and just train them for gratitude, what you will do is you will increase frustration, guilt, and all the ADHD symptoms will worsen. Okay, so therefore you need to first give our remedy, then slowly steadily walk them towards the betterment. And ADHD cannot be treated alone with remedy. You will have to nurture them, you will have to train them to such a beautiful level. And with our remedy will also regulate to that certain level. Okay, so gratitude after regulation will emerge spontaneously. It will become stable and therapeutic, and long term recovery would be there. So what Hahnemann has said in the first aphorism, that we need to cure and not just eliminate symptoms, that will be achieved if we follow the sequence, that first the remedy and then regulation. Okay, so in general, this is a toolkit which I practice in every single case, that you use the scales for diagnosis, various diagnosis, whatever you have, you must repertorize in every single case for the right remedy. Especially in ADHD, you follow up with counseling for the family, because the family also goes through a lot in all of that ruckus which is happening because of ADHD. And then once you have given the right remedy, then you introduce gratitude practices. Okay, so this is the toolkit which you follow. It's a foolproof system wherein completely it is bound to give you great results when you do it in this particular sequence. Okay, with that, I thank you all for listening patiently, and I would love to listen your feedbacks, because I'm not able to see you guys here because it's a webinar type, but I would love to hear as to what you would want me to share more. Number one. Number two, how do you see this type of practice, and in what way it is going to be beneficial for you? Thank you so much, Genoveva. Did I keep in time? Yeah. Okay. So I would love to hear on Instagram if you can, tag me, write to me, whatever helped. Yeah. Okay. I'm glad.